In terms of dark eyelids, causes, treatments, best creams, remedies, and more. When you think about the causes of dark eyelids, sometimes it's genetic. Some of my patients come in and they'll say to me, I don't get it, Dr. Downie. I've had these dark eyelids since I'm a little kid. I don't understand what's going on. So I'll ask them, did your mother have them? Did your father have them? Tell me a little bit more. Do you suffer from allergies, asthma, eczema, anything like that? And a lot of my patients will say yes to my varied questions. And then we go through the fact that some of their dark eyelid is caused from their genetics. Some of it might be caused from their rubbing their eyes. So my patients never think that, I should be wearing sunblock all the time. So I tell my patients, underneath your eyes, certainly every single day, rain or shine. Now, if you're exercising in the morning, you want to wear dark sunglasses while you're out running or walking or whatever it is you're doing. But then as you're going to work, the likelihood, unless it's a very humid day, is you're not going to really sweat particularly. So you can even put sunblock on your upper eyelids. And that can help in terms of making them so they're not any darker. So the first thing you would do is do no harm and make them not any darker. The second thing I ask a lot of my patients when they come in and they have dark eyelids and they have dark lips is if they smoke. And so if you smoke, regardless of which way you're smoking, vaping, smoking weed, that can actually darken the tissue of your eyelids and darken the tissue of your lips, as well as changing your tongue color a little bit and changing your inner gums. Don't even get me started. So what I tell those patients is this is an excellent time to quit. If this is bringing you in here and you don't like the way it looks, it's only going to get worse as you age. Every time you light up a cigarette, you're decreasing the oxygen supply to your face. And in doing that, you're causing nicotine deposits on your face that can lead to the darkness in terms of the dark eyelids and dark lips in many cases with my smokers. So those are some of the causes. There are other causes like rubbing your eyes too much, putting on makeup that you have a slight allergy to over and over and over again and re-inflaming the tissue. A lot of my patients never realize that they have an allergy to something in one of their makeup products. And so over time, chronically, it just gets worse and worse and worse until they finally come to see me and I start treating it. I tell my patients I do a lot of topical immunomodulators. So those would be, I use prescriptions, and then I use topical soothing creams. I tell my patients they can use ice, and I tell my patients that they need to really think about everything they're putting around their eyes. Then finally, I ask my patients to please wear sunglasses when they're outside all the time, because the sunglasses are actually giving them a double layer of protection. So they have sunblock and then they have sunglasses on. And a lot of my patients didn't realize how important it was to wear sunglasses all the time. Now, in terms of best creams for dark eyelids, a lot of my patients want to know if there's a miracle cream, and I typically tell them no. The best thing they can use around their eyes is sunscreen, but there are a lot of really excellent, effective, over-the-counter eye creams on the market, as well as eye creams from the dermatology office. So I tell my patients not to buy off of, ye old internet site for their eye cream, because they're putting it on the thinnest skin area of their body and they may have problems. So I go through a list of ingredients, I look at what they have, I tell them what I think, and then I recommend different products to them. So there are a ton of creams out there that are effective, that work well, and there are many things that are going to set you back and make your eyelid issue worse. So you don't want that at all. In terms of home remedies, the best home remedy is ice for dark eyelids. So it soothes the inflammation and makes your eyes just feel not as stinging, not as burning, and not as itching. And then in terms of other things, I tell my patients, if you have any itching, burning, allergy, anything at all, I tell them take an antihistamine, take it every day. They don't interact with the majority of medications and they're safe for the majority of people. So just go ahead and take it so you're not rubbing your eyes. So these are some of the things that I think about. So some creams effectively can treat dark eyelids. And what I mean by that is if you catch your eyes starting to hyperpigment or get dark early, you can use sunscreen, you can use some different eye creams, and you can really roll back some of the darkness. So that's critical that you catch it early. And how they work is they decrease the inflammatory component, and in that way they're treating the pigment. There's a lot of different products like azelaic acid, for example, that are tyrosinase inhibitors. What does that mean in English, Dr. Downie? A tyrosinase inhibitor is something that decreases your dark spots, your dark eyelids, your dark patches. So that's one of those products when used in a topical formulation that can really be effective without being irritating. So that's kind of what you want. In terms of ingredients you should look for, I tell my patients, this is what I do for a living. I could do this blindfolded. So just bring everything into me. We can kind of go through everything. I can give you the heck no pile, the yes, you can use the pile, and the these might not be the best things for you pile. So you knew which direction to go in. And then in terms of common anti-inflammatory ingredients, there's niacinamide, there's azelaic acid, there's hydroquinones, there's cysteamine. There's a bunch of different products on the market that actually help in terms of fading out the dark areas. Glycerin in products, the glycerotinic acid, there's a lot of growth factors in products and peptides in products that my patients love that help with dark circles, dark eyelids, and lines around the eyes. So those are some of the common ingredients. But like I said, I don't really want my patients to figure out what ingredients they need to be looking for in a cream. They can come to me for that. And when it comes to ingredients, they can just look at foods that they're eating and what they're cooking. Let me do that in terms of dark circles. In terms of who should avoid using lid creams, some of my patients come in and they're allergic to everything. So if everything makes you rip and flare and makes your eyes tear and makes your eyes photosensitive, then you should not use anything but sunglasses and some sunscreen and come running in to see me as soon as possible, because those are the patients that unfortunately over time just get worse if they don't do anything about it. One of my patients years ago was fascinating. She was actually aquagenic urticaria patient. So she was actually allergic to water. And her mother didn't believe her, and every time water touched, especially her eyes, because it was such a thin-skinned area, it would swell up and become hive-like and shut her eyes down. So it's fascinating, that whole diagnosis and my treating her. Now that's an extreme example, but that's somebody that obviously can't just go running and using any eyelid cream. So if you know you have a problem, come to see someone who's a professional and get help before it gets really, really far gone where we can't do much with it. And then there's always procedures that we can do. Non-ablative laser resurfacing. Sometimes we can do different skin tightening mechanisms, and sometimes we can do filler to make your eyelids look better also. But that's kind of one step at a time. The first thing we need to do is stop the progression of the pigmentation and the darkness. And then finally, some of the side effects from dark eyelid creams. I believe I said this earlier, but some of the side effects are itching, redness, irritation, hives, swelling, and just generally making you look older than you are, which is the last thing that you want. So anybody that's using any cream around their eyes needs to get it checked first, make sure it's an appropriate product for the quality of their skin, for the type of skin they have, and for what their needs are. Some people come to me for rejuvenation, some come to me for prejuvenation, and many people just want to know how to hydrate the skin around their eyes and decrease fine lines just a little bit. So whatever it is that you want, we have answers. Just come, ask us, we can have a discussion, and we can kind of figure it out.